to the Talkies. Thank you very much for watching the other videos for Celban, and today we are in another speaking session for Celban, and today we are going to talk about how to discharge a patient and how you will be able to present yourself in the role play. So they might give you a situation where you might have to discharge a client, a patient. It could be any disease. It could be discharging with any like post-op condition or any condition. Most likely they'll give you post-surgical cases so that you have enough to involve or indulge in a conversation with the client. So we will be talking about a little bit how you should present yourself when you are going to discharge a patient. So basically regarding discharge, I would talk about an ideal discharge planning that nurses can do. And Agency for Healthcare Research and Quality offers a discharge planning which is called the ideal discharge planning. And among this ideal discharge planning letters, there are like IDEAL. So each of them has a meaning. So I means it includes. Include means you include family of the patient and or any support members if are there. So you need to include all of them in discharge planning of the patient. It should not be just a decision that you are making and just kind of pushing it on the client, but it should be a decision or discussion with the family members or friends and the patient itself. Then D stands for discuss. So discuss means that you are discussing the options for the client, that what problems the client can face when the client is going home, what medication client should go on, what kind of diet client should be taking, and what else needs to be educated in regards to having certain procedure, like if the client is going with a ileostomy, so there should be stomach care will be involved, bag change involvement will be there if the client is going with some surgery, so there is a wound care that has to be involved in that. So we need to discuss all the options for the client, that who is going to be changing the dressing, or if it's something that patient's relative can learn, or if certain nurse has to be assigned for that, or the client will have some visits from healthcare professional. So all those topics need to be discussed with the client. And then comes the education, E as in education. So education means you will have to let your client understand about his or her condition, about what things has to be done or what not to be done while the client will be going from the hospital. So there has to be dietary modifications, there has to be some medication which the client will be taking in. So that education part is very, very important, and we need to, it's not only just educating, but we need to at this point understand if client is able to understand you or not. It's just not that you're just handing over some brochures or just giving them the material. No, but you have to make sure that the client understands what he or she should be doing, or what they expect from their discharge. And then it comes the A of that ideal, and A is the assessment. So assessment means you are assessing the patient before you're discharging. You are assessing the pain of the patient, you're assessing the level of understanding client is having now for whatever you have explained to the client. So all those things you need to take care. So when is the client going to come back, whether client understands for the follow-ups, for the medications. So you have to assess all the condition. And then last is the L. So L means you have to listen to the client itself. If client has any concerns, if your patient has any concerns, if they have any questions regarding the diet, if they have any questions regarding visiting the doctor again, or they could be any number of things. So we should make sure that we are taking care of all these things. So even when you're going to doing this role play, keeping all these things in your mind will help you to formulate a script, no matter what condition they are going to give you in that role play. Okay, so we are going to do this discussion in the form of role play also, so do watch this video, and also you can comment, as you know, and you can like, subscribe, and share to others so that others can be helped as well, those who are preparing for Celban. It'll be a good learning experience for them. And if you like something, do comment, and of course if there is something more that you need to you need me to do, you can leave that in the comments. And I'm really thankful for somebody who commented that they need some writing stuff to be uploaded on the channel. Soon I'm going to upload the written work as well. So thank you very much for watching, and so stay tuned for. Hi, welcome to the session for role play, and in this play we are going to show how you are going to discharge a patient. Now in Celban speaking session, first module we already, first part of the speaking we already discussed about the assessment of the patient, and we discussed how you will be doing the assessment and how you should talk to the patient. But in terms of discharging a patient, there will be a little slightly different things, but of course you are still acting as a registered nurse, so you need to remember taking consent from the patient when you're starting the conversation. Here most part will be regarding educating the client, because the client is being discharged and there will be some medication to follow up. There could be any exercises, there could be any procedure that client might need to do when he or she is being discharged. So let's see, just have a look at this role play, and if you would have any questions, you can leave it down there in the comments. Okay, so I have Poojan here with me. She will be acting as a patient now for me, and we are going to discuss the condition if the patient is being discharged with post-ileostomy condition, and now a person is ready to go home, but there is still a stoma there. So what all things in Celban speaking test they want you to speak about. Okay. Hello Poojan, my name is Tara. I am your registered nurse for today, and how are you feeling today?
I'm feeling good.
Feeling better? Is there any pain you have?
I have a little pain in my stomach because I have a stoma here, and it's hurting me.
But is it gone down than previous days, or is it still the same?
It's really better before the previous day, but still it's little bit giving me a trouble.
Okay, and if I ask you, like, if you can tell me about your pain on the scale of 0 to 10, like 0 means no pain and 10 means the worst pain imaginable, how would you rate your pain?
Yeah, I'm feeling better now. My pain is 3.
3.
Yeah.
Okay, so that seems like much better than previous. Okay, that's very good. But in case you see that your pain is like more than this and you need a pain medication, we have listed the pain medication that you can take when you need it. And but any point of a time you think that the pain is like something that you cannot tolerate, you can definitely call the hospital. Okay. And okay. So the other things that I need to discuss with you is regarding your diet. So you do understand that you cannot take like solid food. I mean, you have to be like taking food like in small portions, take frequently, and take more of liquids. Do you have any questions about that?
Yeah, I need to like more about my dietary modifications, what kind of liquid food I have to eat and what not, what timings, what portion, these all things I need to know about that.
Yep, sure, definitely. Well, there is a detailed description of what kind of diet you'll be taking is here with you. You can take like any kind of food, but the thing is that it should be soft food. We have to avoid taking any foods which produces gas, like eggs can produce gas too. So things like that, they have to be avoided, and the diet which you are not supposed to take, it's also listed here. And of course, even if you need more options to it, I mean, you can have a look into it and your dietitian can have a chat with you regarding that. Okay? Yeah, because we want you to digest better and so that you can improve, and once that bag is out and your stomach is closed, you'll be able to put on a better diet and desirable things that you would want to eat. All right, and regarding the medication, I've already explained you that you need to take your antibiotics as prescribed as well. And because you're returning back to your work, I would say avoid lifting anything heavier and do not strain yourself, do not stress yourself. Okay, and if any point of a time like you develop fever or there is like pain, as I told you, like goes higher, you need to consult your doctor. Your appointment is next week, but if you think that you need to see your doctor before that, you can let us know and we'll try to prepone the appointment. And if the appointment cannot be preponed, see your family doctor. And in case of emergency, call 911. Okay, do you have any other questions? Okay, so all the information needed is attached with your discharge papers. You can have a look at it and you can let me know. I'm just going to leave you for now and I'll let your doctor know, and your dietitian will be on the way to take care of the diet as you mentioned to me. Okay then? Thank you. Okay, so thank you very much, Poojan, and thank you very much for watching it. And review this and prepare well for your Celban exam. This is something you can do it because being a nurse, that's what you have studied doing all this. Remember, try to take a look of all the systems like your GI system, looking into cardio, renal. So have an idea that what kind of discharge things you need to put in your talk. Like few things will remain same for everybody regarding like what kind of medication. People will mostly be discharged with pain medication, some antibiotics, and they will be discharged with some like exercise plan. They will be discharged with some dietary modification. Patients will be discharged with you'll also tell the patient about the follow-up appointment with the doctor, or if there is any social support is needed, or or if anything else person has requested, some maybe stomachache nurse will be visiting the client for the follow-up at home, or if there is any other special healthcare person is going to visit the person, so you need to let that person know. In Celban, they are going to hand over you little detail of what you basically going to talk about. They'll outline you things for you, so it's not going to be everything that you have to make up. You'll have to follow their guideline and just fill it in. Okay, so thank you very much for watching it, and see you in my next video.